Prime Minister Narendra Modi chaired a high-level meeting yesterday to assess the COVID-19 situation in the country, the preparedness of health infrastructure and logistics, the status of vaccination campaign and the emergence of the new COVID-19 variants and their public health implications for the country. The meeting was attended by Home Minister Amit Shah, Health Minister Mansukh Mandavia, Jyotiraditya Scindia, Dr. S. Jaishankar, Dr. V.K. Paul, who is the member of Health Niti Aayog, and others. PM Modi cautioned against the complexity and advised the vigil as he reiterated that the COVID is not over yet. The Prime Minister also directed officials to strengthen the ongoing surveillance measures, especially at international airports. That's the latest we are gathering in for our viewers. I also have Dr. Ishwar Gilada joining me on the broadcast. Now, Dr. Gilada, I was having this conversation with Dr. Naresh also. Sir, new variant, how do you think India should move forward now, learning from their past experiences?
Yeah, good morning. Thank you very much for having me on this show. When the Honorable Prime Minister is having a meeting, that means they must be having some intelligence information. However, what we see scientifically and in real life science is that current variant in India is only Omicron 2, and that to 2.1, 0.1 and 2.75, and that makes XBB. So almost 70% of the people currently infected are XBB. We may have seen a couple of cases of BF7, but that is not now. That we started seeing from July. So if that was so infectious, we could have seen millions of cases by now in last 5 months. It has not happened. Secondly, whatever things are being pushed in other countries, they are not BA2 or BA3. In India, we did not see BA4 and BA5. All the new subvariants are from BA5. So whether it is in America, which is Q1 virus, BQ1, or in China, which is BF.7. China is surrounded by other 4 or 5 countries, China, Japan, Taiwan, South Korea. And America has a similar kind of virus in Brazil and some parts of Europe. So if we want to compare, India is uncomparable to either East or the West. There are 2 things which has helped India. Number one, the natural infection. Because of the Delta wave, we are once bitten, twice shy. We do not want to be caught off guard. And therefore, heightened precautions are required. But there is no need to panic. Secondly, we had an excellent vaccination. And vaccination is around 75% of the population vaccinated. Most importantly, our vaccine is very good. Now, I will give you an example of what China is using is Sinovac and what West has used is the mRNA. Earlier, we used to think that mRNA vaccine is much better than our AstraZeneca or Covishield. But there is one study done in Malaysia. So it is not Indian study, it is not biased study. In Malaysia, they looked at the 3 vaccine comparison. Number 1 was AstraZeneca, number 2 was Pfizer mRNA, number 3 was Sinovac. So those people who get infection after vaccination, and some people may have died out of that. So they compared, if 1 person died of AstraZeneca, 2.5 times more people died of mRNA, and 10 times more people died of Sinovac. So if Sinovac is such a useless vaccine and China is using that, they are bound to suffer. Secondly, they had a very strictest lockdown all around. This virus is such that it is going to touch everybody. Either you take vaccination or it will infect you. So almost 90% people in India are infected because we opened up and China did not allow to do that. So it will happen. And lastly, China had made a grave for other people. Now they have to bury themselves. No one in the world is saying that China has not made the virus. And WHO has appointed 3-4 committees. Till today, they have not come out with a reality. But I heard WHO chief saying 2 days before that China is not telling the truth. If they tell the truth, we'll help them. They should come out with detail. They should come out with the studies. So this is a diplomatic language. But basically, now trying to say that China has done this. But they have not come out categorically. So I don't think India will face any big problem. I don't think we'll have a fourth wave anytime now or in near future. The fourth wave was supposed to be contemplated to be coming by 21st of June 2022, and that was by the National COVID Projection Council, which is by IITians and all non-medical people. And I have been telling since then that it is not going to come. It has not come. So I think when we are reporting hardly 1,000 cases in a week, I don't think that will become a million sometime. So I don't think we should be panicked. We should enjoy the new year. However, if you use mask, nobody is going to stop you. It is going to benefit you because there are other infections going on in the community which are more chances than COVID, and that is H1N1, RSV virus, common cold. So it will be always protective. And if you use mask, nobody is going to stop you why you are using mask. So it is voluntary, but it is not compulsory.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.